Good evening, everyone. I'm Gary Christenson, Mayor of the City of Malden, and if you see me smiling just a little bit more than previous shows, that's because our team that is here tonight has made some really great progress in helping us get to where we want to go relative to COVID-19. They've done such a good job that I'm actually going to take a few minutes to talk about something other than COVID-19. So if you'll indulge me just for a minute, we do want to let everyone know that we have an important initiative that has been going on for several months despite the pandemic, and that's a credit to our community who never stopped working. And so as part of the Unite Malden 2020 initiative, we signed on to the Obama Foundation's pledge that calls on cities and towns to review police use of force policies, engage the community in conversation, and then report findings. So we formed an advisory group to assist us in reviewing the Malden Police Department's use of force policy. And they have been working, as I said, for the past several months to not only review the policy, but to also come up with some recommended changes. So now it's your turn. We are seeking input from the community on the drafted recommendations, and there are several ways you can get involved. So the first thing we want to ask for more information, please check out the website, which Mr. Ron Cochran, I think, is going to put up on the screen right now.
Correct.
And Ron, what is it? cityofmalden.org
/ Unite Malden 2020.
Okay. So once you get to this page, you will find information about the current use of force policy, the recommendations made by the advisory group, as well as an online survey. So we ask you that you take the survey. The information is translated in different languages. And we've also scheduled a community meeting on June 10th at 6:30 p.m. on Zoom, at which time the recommendations will be presented and they will answer any questions that you may have. Again, please check out the website. Public input is critical to us being able to get to where we want to go. So let me just close by thanking that advisory group publicly. This is something that they've been working on for some time during the highs and the lows of the pandemic, and now we're at a point that we could really use your assistance. So with that being said, let me get back to the regularly broadcast channel, and that is who else but UMA, formerly known as MATV, and we must thank them, as we always do, for organizing this update for us. So, Mr. Cochran, do you want to, everybody knows you, I was going to introduce you, but the community knows who you are. So why don't you introduce our panel for this evening, and then we'll get into the questions.
Sure, no problem. Just in case anybody out there hasn't heard my voice by now, I'm Ron Cochran. I'm the communications director here in the city of Malden in Mayor Christenson's office. And pleased, as always, to join you for this important show that we've been doing now for many, many weeks, over a year now. And we have with us a couple of regular guests, and we also have some new guests with us. First, we have our public health director, our health director, Chris Webb. And then from Cambridge Health Alliance, we have Christian Lanphere. And then we also have Jennifer. Now, Jennifer's joined us, but I think by phone. Can I get a hello from you, Jennifer? I just want to make sure you have us here.
Hi, this is Jenny C. from Greater Malden Asian American Community Coalition.
Oh, great.
Wonderful. Thank you. Thank you very much. That audio sounds great. And then, of course, we have the Reverend Myrlande-DesRosiers. Is that
perfect.
Close?
That was perfect.
Oh, man, I'm sweating. Oh. So I think, okay, so thank you. And we'll give you guys a chance. We usually like to go around and kind of let everyone update on their various areas, but I'll kick it back to Mayor Christenson from here.
Okay, very good. Thank you, Mr. Cochran. And why don't we do just that? So the audience gets to hear a little bit from our panelists. And if you would, when you make your introductory comments, which shouldn't be more than a couple minutes, please just include your contact information in case someone on this call comes up with a question after the show ends. So we'll start, of course, with Mr. Webb, our health director. Hi, Chris.
Good evening, Mr. Mayor, and everybody out there watching again. I appreciate you tuning in. It's been a long year. I'd like to think we're getting better at this, and our communication is getting better. And I think tonight will prove that. We have some partners, community partners here that have been doing some outstanding work in the community. And I asked the mayor if we could have them on for this session so that we could, share the knowledge that they have, and you can all understand better how the outreach has been going on and who's really behind how you get informed. And if you want to reach me, I can be reached at 781-397-7049 or email me at cwebb, W-E-B-B, @cityofmalden.org.
All right, very good. Mr. Lanphere.
Good evening, Malden, and thank you, Mr. Mayor. My name is Christian Lanphere, and I'm from the Cambridge Health Alliance. I would say from the Cambridge Health Alliance's perspective, which is a good thing, our patients, COVID volume patients, have dramatically decreased. They're not completely absent, although we've had, I would say, about 72 hours where we had no COVID patients at all in the health system, which was a huge, huge plus for us. We've seen a few. We'll take a few. A few is better than a ton. So I would say that things are continuing to trend in the direction we want them to, but I think we still have a lot of work to do to get those who have a lot of questions or are not really able to get vaccinated yet, and how we can help them make a honest and safe decision for themselves and their family.
Very good. Thank you. Over to the Reverend.
Good evening. It's a pleasure to join you this evening. Good evening, Mr. Mayor. Nice to meet you. And thank you, Chris. I think now we're family. We've been working for quite a while, a very short time, but we've known it's like we've known each other for a very long time. And I think that's what happens when we are united with one specific common goal, which is to save lives and get people on board for the vaccine. It's a pleasure joining you. I'm from the Everett Haitian Community Center, but do not let that fool you. We serve a lot of communities, people in the various communities in the North Shore, including Malden, 7,000 to 8,000 people on a given year. I'm also associate pastor of the New Covenant Church of Cambridge in Waltham, which also has a membership of 600 members, many of them also residents of Malden, and our senior pastor is a resident of Malden. If you would like to reach me during this conversation or thereafter, I can be reached at 857-251-9866. Thank you for having me.
Perfect. Over to Jenny.
Hi, thank you everybody for having us today. My name is Jenny C. I am the Program Director for the Greater Malden Asian American Community Coalition, or GMAACC for short. We serve primarily the Asian American community in Malden and the nearby areas, but also collaborate with a number of other community organizations to serve different members of our city. I think one thing we wanted to highlight is that, especially for COVID vaccine promotion work, we have been partnering pretty closely with Malden Neighbors Helping Neighbors, which is a local mutual aid volunteer group, as well as the Everett Haitian Community Center, EHCC, to set up helplines for people to call in, and we will try to support people with whatever needs they have around getting a vaccine or any of the logistics surrounding that. If people would like to find out a bit more about what we do and reach out to us, I think the easiest way is probably to find our website at GMAACC, which is spelled GMAACC.org. GMAACC.org, and then you can find our phone number and our email addresses on there as well. Thanks.
Very good. Thank you, Jenny. And right on cue, we have our last panelist, Bybiose LaRochelle, who was just downstairs working with us to celebrate our first official Pride Month celebration. So thank you, Bybiose, for being in two places at once. So Bybiose, why don't you tell the community a little bit about you and how to reach you if they have any questions after the show.
Hello, everyone. My name is Bybiose LaRochelle, and I'm the Diversity, Equity, and Inclusion Coordinator here in the Mayor's Office and for the City of Malden. My contact for my email is blarochelle@cityofmalden.org. And also my phone number is 781-397-7000, extension 2006.
Okay, very good, Bybiose. So we get a little feedback. So I think Ron Cochran's going to try to text you to see if there's a way we can figure that out. But in the meantime, I guess the first obvious question, Mr. Webb, where are we? How are we doing?
We're doing really well. We could be doing better, and that's really kind of the focus of this show, I think, is that there's a lot of folks out there who are too busy, too employed, undertimed, and over-childrened to be able to get where they need to go and be vaccinated. So what we're trying to do is figure out who exactly those people are. We've got the two groups with us tonight. We also have a grant program with Healthcare for All, and they're out canvassing the neighborhoods. I know folks have seen the people out. We've had some feedback from that. Some of it not good, but most of it very good. So we're glad that they're out there. They're giving us very strong information, and hopefully they're repetitive in their motion. So what we find is that with the non-vaccinated crowd is shrinking, but at an impressive rate, actually. But we'd really like to identify who those people are now that it's such a small number, maybe 2,000, and to give them invitations to tell us when it's going to work for them. And we'll categorize those communities, and we'll fit their schedules or their needs somehow, some way, and get anybody that we get in contact with and a shot. And hopefully, I haven't had a chance really to talk to the Reverend or Jennifer about this, but it just was something that came to mind yesterday morning, and I sent Healthcare for All an email. They're working on it. It's not 100% that they'll be able to develop that list, but they'll get us something close to it, I think, and it'll be useful. And I'll share it, and we'll be able to compartmentalize groups and then each one of us with our particular expertise will be able to deal with them and meet their need, I hope.
All right, Chris, and just before I jump to Christian, what are the latest numbers? What's our positivity rate?
Our positivity rate is 1.07, I believe. It's very low, but that's a number we're going to want to keep an eye on over the next 2 weeks, as we usually do after we see large events and things like that. Right. So we've got the events that are coming up. I mean, I don't know if anybody saw the Indianapolis 500 on Sunday, but I got chills when I saw that crowd. I mean, first it was exciting, and then I realized, wow, all these people are going to go to multiple states, and that's scary thought. So I'm going to be very interested to see if anything traces back to the Indy 500, and then I will be able to determine, we'll look at what their infectious rate was and their surrounding states, and see if it's really an impactful thing or not.
Christian, you mentioned in your opening remarks, did you say past 2 nights you haven't had anyone in?
So we had a period of 72 hours.
And when's the last time you've seen that?
We have not seen something like that since before COVID began.
Wow.
So that is a huge milestone, I think, for all of us. Right. And the numbers continue to trend down, and there's more ICU beds available for regular medical emergencies. So this is all very good news. And I would say over the weekend, as the mask mandate started to be lifted, I was still very much pleased, I think, based on what some of the conversations Chris had, as I was mulling out and about in the communities, just how many people were still wearing masks.
Right.
And I think
yours truly, Christian, including yours truly.
Yeah. And I think it's a smart thing to do. I think that we're still not out of the woods. I think we got a little bit of time, but I do think, and I appreciate, people are still taking this very, very seriously, because if you've had COVID and you got really sick from it, you don't want it. So we can all do our part to help each other out.
Yeah, very good. So now I want to let the final 3 panelists know how pleased and proud I was when I last spoke with the state. They told me from where we started to where we are now is a credit to you 3. So I want to ask each of you individually, how have you done it? How have you taken us to a place that the state, and they've been tough about this, to say that, we're getting to where they wanted us to go? Let's start with you, Reverend. How have you done it? I think you're on mute.
Yes,
Yeah,
thank you
no.
very well. Thank you very much. First of all, congratulations. We say the congratulations to the city of Malden. First of all, to do that because it takes two to tango. I would say, I'll just say bluntly, number one, the collaborative partnership is
Got it.
key. When you have several minds with one goal, that's the whole thing, with one goal, and with specific strategic um, all hands on deck approach. That's what Malden needed, and that's what it needs, and it will continue to need. Secondly, I would also add, as we progressively make it more accessible, to people where they're at. I'll just give one quick example. I think perhaps Jennifer could tap on that. One example we would give is what we did collaboratively with CHA, with many people involved, with the city of Malden, in the local churches, bringing it where people are at. And
Okay.
exactly, the 87% of the people, especially in Malden, who are at least Haitians, are churchgoers.
Right.
You have a small number of Catholics. You have just one denomination that doesn't believe in the vaccine, but it's very minimal. But the other are evangelicals, but evangelicals in another way, because Haitian evangelicals actually do believe, in the science. We work with the pastors, and so in the faith community. So I would say, I'm a pastor, so I'd say God, collaboration with the city. You have a great team. Congratulations. That's really willing to work with community. Thank you, Chris. And also really bringing in the community organizations with the cultural appropriateness. I think that has helped, and that will continue to take you and us where we hope and pray to be.
All right, good transition over to Bybiose, because the moment I'll remember for a long time was the Haitian Daycare Center on Commercial Street, when you went right in and arranged a clinic with Chris that resulted in over 50 people vaccinated, right? So boots on the ground, I think, is what you were telling me. Is that what has helped?
Absolutely. Boots on the ground and outreach. I think Chris has done a really good job of kind of partnering up medicine with cultural sensitivity and making sure that we're getting out there, we're talking to people, limiting barriers such as language access, transportation barriers. We're really just trying to make sure that everyone is knowledgeable, everyone's getting their answers answered, their questions answered, and that we're making sure that everyone is moving forward and understanding the process. And also building trust during this time. We really want our residents in Malden to trust us, and know that we're here to support them through anything that's happening, not solely the pandemic, but this is where that starting point just happened. I'm very fortunate that we've used many of our local churches to do our clinics, and we'll continue to do that, and we'll meet people where it's at. That means on the street, that means at your job, that means the grocery store, wherever you need us, we will be there. We're here to support everyone.
All right, very good. Jenny, what's been the secret for GMAACC?
I think we don't so much have a secret as I think we just try as many channels as we can possibly get our hands onto. I totally appreciate what Reverend Myrlande and Bybiose had highlighted in terms of getting the clinics to where the community members are. And I think that just in the last month, we've had, I think, a lot of success getting the word out about the Malden City clinics that were hosted at Anthony's and then later at the Malden Public Schools to really make sure that community members know that this is where the clinics are happening and that they're accessible to everybody, and the time and place, and trying to make the process as easy as possible for everybody to participate. We have been putting up a lot of flyers and posters around the city to direct people to sources of information, like here are the websites where you would be able to find the latest locations and times of the clinics. Here are the numbers that you can call to get help, and really just making that as available to everybody as possible. and we want to continue to keep doing that.
Okay, very good. Let me stay with the panelists that have been doing a lot of the outreach. So Christian and Chris, you get a little breather here. You deserve it after, I forget how many shows Talonzo said this was, but the one stubborn category, I think it's NH Black, is that non-Hispanic Black, I believe. That has been stubborn throughout, even with the added outreach. Why is that? What are you hearing when you're out and about as to why we cannot boost that category? Let me start with the Reverend and then Bybiose and then Jenny.
I apologize. Would you repeat the question?
Yeah, the one category in the equity vaccine report. Chris, do I have that right? I think it's categorized under Black. I think it's NH Black, that we're still below the state average, despite the outreach that has been going on. And so I was curious as to whether or not you have some ideas as to why that is, despite all the good work that everybody on this call has been doing.
Yes, absolutely. But however, if you look at the scale, you will see it's been up more than
From
it
when
has
we first started.
Exactly.
Okay.
So, yes,
okay.
you will see that.
But we're still off. We're still off from the statewide average, I believe, by 10 percentage points.
Exactly. And the way, and we've what we would say, for quite some time, it has not happened as in Boston, in bringing it specifically to the Black colored community specifically. We've just recently started, for example, to bring in the churches. EHCC, for example, our organization, we have under our belt 3 communities: the Portuguese, the Brazilian community, Portuguese speaking, the Spanish, we collaborate, and also Haitian Americans in 6 cities and towns, including Malden. So we see that more, for example, in Boston, Charlestown, East Boston, the Blacks, it's higher it's because of what is happening now, where we actually bringing the clinics within the community.
Okay. So nowhere but up. These numbers, this gap will close with the state, you believe?
Exactly. Absolutely. Okay. Secondly, one thing we need to keep in mind as well, each community is different. And we've always said from the get-go that, and when it comes to that community, and also realistically, based on history, it's a slow pace. It's a slow pace. You will see progress, but not in mass, but in slow pace, but as you bring it into the community and using actually culturally appropriate mechanism. What works, the way we approach Catholic Haitians, for example, is at the same message that we use for Protestant.
Okay.
And the message that we use for young people, it's not the same that we should use for older people. So I would say that even in that category, steadily but steadfastly, in a slow pace, bring it into the community. And what we've mentioned before at the last meeting is really using unconventional hours for getting people the vaccine. Why? 95% of this population works a 7 to 3, 3 to 11, 11 to 7 shift. And they are low income people, in addition to the fear of the vaccine, right? So it's addressing this need in terms of the providing it, getting it where they're at, packaging the message in a way that they will take it and accept. And number 3, bringing the vaccine into that specific community, also agreeing in a slow pace. It will always be in a slow pace. And also DPH can understand that as well, that you will see that, but it's still in the slow pace with that community, because that's how it is in general.
All right, Bybiose, you feel the same?
I absolutely agree. That was a great point, that it is a slow pace, but we just need to be patient. And a lot of that means that we need to communicate constantly, get the information out there, be willing to ask questions, also to refer questions if I cannot answer it to medical providers, to any medical professional, or even, Chris Webb. I always, send people emails, say, I'm not sure of the answer, but Chris can give you that answer. So it is going to be a slow moving train, but it's okay. I think everyone will get on that train. We just have to really give them that information and be open and honest and transparent and build those relationships. I think, there's some fractured relationships in these communities. And once we can reach out and people know that, the city of Malden is a safe space and we're really trying to protect their health and we want to see them live and survive and live beautiful lives, then they'll be able to understand that we're trying to offer something that's for their benefit.
All right, very good. And Jenny, do you want to add anything?
Sure. I'll quickly add that I guess I can't speak specifically to the non-Hispanic Black community in Malden because, I don't have as much familiarity with these community members as compared to Reverend Myrlande and Bybiose's work. But something that we have heard from community members in general who are having issues, accessing the vaccine, very often it boils down to people like Reverend Myrlande had mentioned, people are working and they just may not be able to make it to the vaccine sites at the usual times. And then also for people who are both working and also taking care of other people in their lives, like children or other elderly people living with them, often people are just very hesitant about the possibility of having to miss work or the ability to take care of others based on possible side effects from the vaccine. So I think both helping people understand that the side effects are manageable symptoms and then also providing community support to help out with people. Like if, they are feeling discomfort after getting vaccinated, then maybe we could provide them with a couple of meals so that they don't have to cook as much to be able to support their family. Just providing, alternative ways to support people that can be really helpful just to get people across the last mile to get vaccinated.
All right, well said. All right, let's go back to Chris and Christian. So the next question that we had come in, has Malden reached herd immunity? And if not, where do you think we are on the percentage of fully vaccinated people, Chris?
I'm going to say no. I would say that, we don't have enough data, first of all. I don't like to say anything that isn't data verified. But what you're looking at for herd immunity is a couple of things. Of course, the number of people vaccinated, the number of people who were ill and now have antigens. But even that's not a great number because we don't know how long your antigens give you immunity for sure yet. I mean, it's past the 90-day mark now. We know that, but we don't know how much further past that. Maybe 120? Is it 6 months, 10 months? We don't know. So I don't like to be able to say that anybody's at herd immunity. We're millions of people away from being halfway, to the herd immunity number. It's 70% of the entire population. So we've got a long way to go yet, nationally. And think about it. I know everybody's saying, well, we're in Malden, but a lot of people pass through here every day. We learn that, if nothing else, through this process, that world travelers come through Malden every day through the train system. They go to see the hospitals. They go to do business, do all kinds of things. So I don't like to say, yeah, we're close. I think that if you take a lot of things into consideration, we're very close, but it's millions of people off yet.
All right, very good. Now, Christian, you've always had your ear to the ground around variants. What are you seeing here and abroad? What's the latest regarding variants?
There are variants here. Obviously, the Brazilian variant is one I think that we're seeing most common. I think we're also seeing the UK variant. We have not seen, as of yet, anything from India or Vietnam. But keep in mind, we're not, unless we have a real need or a clinically an appropriate need to do genome sequencing, we're really not doing a lot of genome sequencing. We are genome sequencing patients who have a very different presentation to better understand what if they have one of the variants. But a lot of that's being done at the state lab, and it is a slow process. So I don't want people to think this moves fast. It does not move fast. But what it does do is it gives us some general ideas about variants, that are moving about in the communities. And I want to, reach back to what Chris was talking about. with herd immunity, because the Boston area welcomes, millions of people every year, and we're all transiting in and out of these communities, I think it would be very difficult to obtain herd immunity without getting a huge number of people vaccinated. But the good thing is, I think that these vaccines have certainly demonstrated that they've been able to stand up to the variants, and we are tracking what we call the breakthrough infections. And the breakthrough infections are something we're reporting to the State Department of Public Health now is anyone who's admitted to the hospital who has been past their second week after the second dose of either Moderna or Pfizer, or 2 weeks after Johnson & Johnson, and they've tested positive for COVID. What we've seen a few of those, their symptoms are very, very mild compared to what it probably could have been. So I do think that the folks who did create these vaccines have really did a very good job of holding this virus at bay, at least for a while. So,
Ron, do you have any questions that have come in, or you want me to keep going?
Yeah, I think the only one I have so far, you sort of covered it, and there was on the news lately, there was that the Indian variant has showed up, and it's now a concern. And I think you sort of covered that, but I don't know if you want to elaborate on specifically that variant.
Christian?
Well, I think both manufacturers have come out with their clinical evidence to demonstrate that the vaccines are currently are able to fight those variants. And we have to remember, variants, it's a nice fancy term, but viruses are really designed to continue to live and adapt. And so that's exactly what these variants, they're changing shape, and that's what they're doing. But the vaccines so far have done a really good job of really holding it at bay.
And Christian, maybe I can go to Chris. What Christian just said, is that on all vaccines have held their own?
Yes, they've all shown remarkable ability to at least minimize, if you do get sick, minimize the symptoms that you have to, bear through. People just aren't getting sick. They're not being hospitalized. They're generally given, aspirin, go home and let us know if it gets worse kind of thing, just like they do in flu season. But the people I'm concerned about aren't the vaccinated. It's the unvaccinated, right? So if the unvaccinated are in the can hear my voice, you're at more of a disadvantage than a vaccinated person for simply one reason. The Indian variant is more contagious than the current COVID-19 that we're dealing with. So it's likely to spread in the unvaccinated community quicker and have more of a medical effect on Americans. We're all 98.6, like I like to say, but we all live different lifestyles, and morbid obesity is a huge problem in this country. And if the Indian variant has any relation to the original virus, we know that population is at risk.
Okay.
So I know we all talk about vaccinated people, but the story of the day really has to be those who aren't.
So
they're
based
the most
on
at risk.
So based on that, Reverend, what Chris just said, what are the top 2 or 3 reasons why people won't get vaccinated? I think Jenny touched on a few. What are you hearing out in the community? Is it side effects? Is it the unknown about how long it lasts? What are they telling you?
Well, it's a combination. So I'll go with the top 3 or 4.
Okay.
Number one, for in the beginning in the faith community, it was twofold. Number one, there was a lot of talk that it was the mark of the beast. So God doesn't want us to take this vaccine because it's the mark of the beast, right? And especially, and if you look at Malden, you have a good population of the churchgoers there that believed in that. Then we start losing a lot of pastors through COVID. And then as we continue to do the outreach and work and change the way we worked with the faith community, which is really getting them, at the table, not just talk to your parishioners and tell them to take the vaccine, or you should. Now you start seeing clergy taking the vaccine, And we design a guide, sort of a guidance, for churches, and they're using that and even using it in their sermons. So now that's why it's getting a little bit better. So that's what we do. For example, the last weekend, the same way, I had to preach in 2 churches. I did the same. I included that in the message, and we had tabling right on spot. On the spot. So, and then so that was the first thing that it was not godly to do it. Secondly, there was something that most people did not talk about because didn't know, especially if you're not Haitians. For many who followed the news, it was in the news on CNN that they could not understand why such a poor country as Haiti, people, the pandemic was not doing damage. It's like it was it's very low in Haiti. So people thought that they're immune to it because we're Haitians. It's because of the tea that we drank, and something that we have because, it's not, if it should be bad in a country, it should be in Haiti because it's poor. But it's been, yeah. And now, 1 month after the news from CNN, now we hear from the president now it's up. So now people, are changing their mind a little bit that we're not so immune. The third thing, of course, that we've heard a lot was also the fact that, they believe that there are different vaccines. Those for white folks, that's why white folks are getting it. And another one designed for Black folks. Well, let's wait for the white folks to get it first, and then we'll see how that works. If they're really good, if it works for them, then we'll tag along. And then last but not least, which is primordial, is also the fact that even those people, we believe, if from the beginning, and we don't like to go backward, we want to continue forward, but we're just mentioning this, is that once it's in their face, once it's where they can get it, right? Places that they trust, and because it's the lack of trust that also additionally that they're not getting it. So that will change things, and that's why we believe that you will continue to see progress and change in a slow pace. We would say so many we can mention, but these are the top ones.
Very good, very good. Bybiose, anything you want to add? And then I'll go to Jenny.
No, I think the Reverend did a great job of, recapping that. I think one of the issues that we just need to make sure that we're always putting on our forefront is how we can blend Eastern and Western medicine together. I think many countries, they practice Eastern medicine, and so they're not really having a form of trust with Western medicine, and we need to figure out how we can have those conversations and it's palatable to them. The Reverend gave a good example, like, oh, they drink all these teas, and the teas are very, very helpful. But we also have to know that there's a limitation to those teas. And so we have to figure out how, if the teas aren't working, what's the next step? And I think that's being culturally sensitive, having those conversations, making people feel safe and don't feel like they're being talked to or talked down to meet them where they're at. So I think that we have this approach that's been helpful. And if we consistently just work on these streets and talk to people, hand out flyers, do as much work as possible, that we will get those communities that are really struggling to understand the concept of the vaccine or even have access. I think access is another issue. I get many calls that people just don't know where the clinics are. And I just think that we put it out there as much as possible. We just need to think of some unconventional ways to also get the message out. And I think that we've, hired some people to really work on that. We have great collaborations and we're really trying that right now. So I see that number increasing really soon.
All right, over to you, Jenny.
I absolutely agree with everything that the Reverend and Bybiose had said before. I think that two of the main barriers that we see on the one side, there are logistical barriers that include, people knowing the time and place and getting to the time and place, and as well as language barriers is often the biggest barrier that we see, at least among the Asian American community, who may not be fluent in English, having to deal with registration processes that are always entirely in English. And that's a kind of service that we have really aimed to try and provide and support people with their needs. And then on top of that, I think there's also, hesitancy in the form of just understanding like how the vaccine may be beneficial and how it fits with people's views of, like health and managing the pandemic, and understanding like, that sometimes the things that the things that people fear can be addressed in a way that doesn't confront or put down people's cultural understanding of how health works, and instead, sort of view it in a more complementary kind of viewpoint. I think we still hear a lot of hesitancy from the Asian American community, which generally speaking have been more accepting of the COVID vaccines, but people are often still concerned about, long-term side effects that maybe the clinical trials have not been able to fully understand at this point, which I think is a fair critique. I myself have a public health background, and, I can point to the evidence that Western medicine has provided thus far and say, among the billions of people who have been vaccinated around the world so far, like here are the reasonable kind of side effects that we have been observing, and here are the things that people fear but may not necessarily be either real or maybe extremely rare. And then just kind of communicating that point in a way that doesn't condescend upon people's like concerns, I think is a really important thing to remember when communicating the benefits of the vaccine.
Okay, thank you. Let's go back to Mr. Webb and Mr. Lanphere. So I know you thought this might be the show where we don't talk about masks, but let me ask you, now with the restrictions lifted, do you see a future for masks beyond just reacting to an uptick in cases? For instance, I know we've talked off and on about, us not really getting any calls about the flu. So do you see a role for these come fall, winter to prevent that and other illnesses? What are your thoughts on it? Or are we done with masks? Chris?
Well, we were talking about it earlier about people going to the supermarkets, and I don't know if it was with this group or another group today, but someone went to the supermarket over the weekend and it was an optional kind of thing. And they went inside and 99% of the people had their masks on. One gentleman made a point to point out that he wasn't wearing a mask for some reason, and most of the people around him asked him to leave. So, and he did. Why is a part of valid there, I think. And I think that people understand that they do have some ability to limit your exposure to airborne particles and virus. And to not take, if you're going to ride the train or a bus or multiple buses to work and in the flu season and you don't have a mask, you're inviting trouble. Why? This is another great way for people to be able to stay at work, make their money back. It's just putting on a mask while you're on the bus or in the train or wherever you are. Those little things, doing that for yourself every day is going to keep you at work. It's going to keep your income right. And I'd like to think that that's going to be a driving force in decision making. Sure. Yeah. I know I'll be doing it. You won't see me walk into a big room without a mask. I mean, I may not have it on, but I'm going to be gauging every room I walk into in flu season for sure.
Interesting. Okay, Christian, you agree?
I think I agree with Chris. I think this will last for, certainly for the next couple of years. I mean, I think we had a very impressive flu season, minimal cases. So I do think that it's got its pluses and minuses. I will let people know that the healthcare systems, all the hospitals in Massachusetts are still subject to the original COVID restrictions. So you still to this day cannot enter a hospital without a mask. That is mandatory. It is imposed on us. The screening requirements, all that stuff is still in place as it was before COVID. So for the healthcare systems, not a lot has changed for us in our world, but certainly walking outside, I think the masks are going to be still worn for some time.
And Christian, do you foresee that being voluntary, or do you think the government might come fall mark off a certain part of the year to say they're required in certain places?
I think it'll be a voluntary thing.
Yeah.
I think that it was a struggle to get people to wear masks. Although I've seen a lot of fashionable masks out there. I mean, there's some really creative folks out there making masks. So I think that there's a little bit of a trendsetter to it as well.
Okay. Ron, anybody queued up? Or any
Ironic.
calls?
That was our second. That was actually our other question that we had in the queue was the mask wearing. So it's ironic that you just covered it. I think to expand upon it, or maybe just to dive into it a little further, I think the question was on the inconsistencies. I think it was articulated nicely, but maybe, I think it would be beneficial to talk about those that are still required, but then also to stress the fact that if you go into a private business, correct me if I'm wrong, Chris, but it's kind of like the no shirt, no service situation. If they're deciding to continue to require masks, there's nothing that necessarily prevents them from doing that if it's a private establishment. Is that correct? Or
That's true. That is true. The establishment owner can decide which of the guidelines they want to maintain, whether it be masks or distancing or any of the, some of the employee measures. I expect a lot of the employee measures will stay. It seems to work. It will keep people healthy and in work. So I think those will stay. The inconsistencies, I hear that a lot. People just are over reading things or reading things into it. It's very simple. I think that if you're vaccinated, you don't necessarily need to wear a mask unless it's posted. If you're not vaccinated, you have to wear a mask everywhere you go. You're just not as safe as someone who's vaccinated. And I can't imagine how that's hard to follow.
Let me jump back to our, who's doing all our outreach, Bybiose. In the conversation here tonight, I presume you've been talking mainly about adults. Are you also working with the Reverend and Jenny to now start focusing on the youth? And if so, what are you hearing on that end of things?
I've actually defaulted that to Chris, where he has been doing a lot of the work within our schools, and that was making sure that all the releases got out, making sure that everybody was aware of the clinics. And I do a great job, I feel, of making sure that if I am aware of a clinic, that I blast it out to everybody. So it wasn't just solely the schools, just in case the student didn't come home with that letter. At least, the parent was aware, and then they can reach out to either the Board of Health, or the principals at the school to get more information. We had some successful clinics, and I think we're going to have a few more. But I definitely will collaborate with the Reverend and Jenny to see how we can get to some of our youth. And I know that I've talked to some other people, like at the Teen Center, who wouldn't mind doing some work over there. So I think we could have some great plans in place in the future.
So, Reverend, when you're talking to families, are any of them telling you, I'll get vaccinated, but I won't vaccinate my kids? And if so, why?
Oh, we've heard that a lot, but we're working on that. The reason why they say that I don't want my kids to, it's not I don't want them to get vaccinated. I don't want them to get vaccinated yet. So we want to make sure that people understand that what we have seen, it's not a categorical refusal, and that's why we don't even call it hesitancy. We will call it with a lack of confidence, which is two different things. So that's why we try to raise the confidence, right? For example, we have a lot of family from Malden last Sunday. At the church that I preached, where we're working. As a matter of fact, what we say is, long time ago, 20 years ago, the way to get to kids and get to word to from the parents. Really, we'll say nowadays, the way to get to parents is through the kids. And so that's why we've had 2 town halls with 14 college students, 17 and up. And we also now working with a group of college students and high school students doing to do a PSA. And they will also include Malden residents. So it's really the let's wait and see how it works. But another thing that we've learned as well is that for the school system, there's another part of it where parents are not signing the consent form, right? To get their kids tested. So we bring that also in the community and into to the church. And as you know, the information about the vaccine, and it's going fast. Yeah. And changes are going fast. So you cannot even use PSAs that you've done before, even a few months ago, or a publicity or ads that you've done, a few weeks ago. So you have to be up to date. And that's what we hope the model that we would like to tap on with Malden and working with Chris and the folks that you have that have the mandate for to do the canvassing, the consultants. If they continue or would like to work with us so that we can help with the packages, with the blurbs, you know what I mean? And what they all they have to do is to be the conduit in terms of paying for the ads and so forth. We will do that. And also important, working with the church community. And it's not just pass the message, here's the information, here's the list of the vac sites. No, it's really collaboratively, having them be part of it every Sunday in Sunday school that they teach for the little kids, that they're hearing that. In Sunday school for adults, they're hearing that as well. And through our local radios and TVs.
Great. Jenny, I know you heavily focus on the youth through GMAACC. Have they been vaccinated? And if not, why are they not being vaccinated? What are they telling you?
I think that what we've been hearing from both the youth and the families is actually pretty similar to what Reverend Myrlande had just mentioned, that there's often more sort of lack of confidence, I think, coming from parents concerning their children, like sort of, wanting to protect their kids from potential side effects. And again, like just this sense of like this technology is very new and the research had just come out and, information is changing constantly. And, maybe we should wait a little bit before like we let our kids, take out this thing for which we don't yet know whether there's going to be adverse consequences. On the other hand, most of the youth that we work with who are a little bit older, high school, juniors, seniors, et cetera, who had been age eligible for example, the Pfizer vaccine earlier, 16 years and above, they have themselves generally been very enthusiastic about getting vaccinated because they feel, safer having this extra layer of protection when they head back into school settings or with, being able to play team sports again, seeing their friends, so I think they see a lot of personal benefit if they have the option to be able to get vaccinated. And I think, just working within that space of, how do you talk to parents to adequately understand what are the benefits, what are the potential sort of concerns, and how do we, carefully monitor the situation so that people can gain more confidence in this technology, I think is what we will like to focus on next.
All right, very good.
Is it possible that I may add just one?
Yeah, please.
Just 1 minute. And to come back to that again, as much as also possible to bring the vaccine, even in small quantity, where they're at. People we've had just this past weekend, we've seen people who have not been very confident, and right on the spot, we have, a table there, people to, register for the vaccine. They hear the message, they hear a sermon, and the table is there. They get some, give handouts of, little gifts and stuff, and they get the information, and then right on the spot, oh, okay, I understand now. Okay, put my name. I want to do it. But we would rather have these people where you have a mobile vaccine access, where at that point where they really want it and they get it, not to think tomorrow, because tomorrow they might change their mind.
Right. I think the place you really need to go is a revival. Funny story before we wrap up. Reverend Pierre out of Medford invited me to my first ever revival. And he said, I need you to be there at 9. I said, okay, that sounds great. So I got on my best suit, best everything, pulled up, opened the doors, no one's there. The revival started at 9 at night.
Mr. Mayor, you went on American Mayor Gary Christenson time. You didn't go
Yeah.
on Haitian time.
So, well, thank you all for being here. Truly, this has been very informative. And I think Mr. Cochran, I would just like to give you a minute to wrap up and again, maybe repeat how to get a hold of you in case there are any questions that come up after the show. So, Mr. Webb.
Thanks everybody for watching tonight. I think it was a great show. It shows you how many people are really out there working for you. I just want to let our partners know that we, through the grants, have been able to hire a really exciting person with incredible language skills for a position to work with the outreach groups and kind of coordinate our efforts. And that way I can spend a little more time hunting down vaccine and getting things set up and ready to go. I'm going to take that information in and we're going to build from there. I also want to thank the Cambridge Health Alliance. I know Christian wouldn't say it, so I will. They had a very successful clinic at the TDM Church on Salem Street a couple of Sundays ago. I happened to be there. It was incredible. First of all, greatest group of people I've spent hours with. I made a lot of friends in minutes. It was fun. People in the walk-in traffic was exceptional. And I want to thank Guilluame-DesRosiers. I think I'm saying her name correctly. She did the majority of the outreach there. And you just had to watch her face when she saw these people that she had already spoken to coming in. It was really exciting to see, and a lot of minds were changed that day, and hopefully they'll bring more people to the fold. So I want to thank CHA and Christian, because he did help us set that up. And lastly, I think we're going to be seeing some more work around the schools. We have to do that. The original outreach was exceptional. I thought it's typical for the school, but we wanted to get a block of students done. So we did just to see what demand would be. It was low. I was surprised how low it was. But what's interesting, and from this conversation too, is we will do it again. And when we get people to minds changed and their children's, interests are truly, they believe us that that's what's at best for their kids, then we'll do it again. And hopefully it'll be a nice sunny day. There haven't been enough of those. So we'll get that's the plan. I have some ideas around reaching out to those who are asking for it, but finding the best time to do it. And then extensive planning around getting more kids vaccinated as well. So we'll be reaching out to our partners through our new hire. I'm so excited. I can't even tell you she's going to be a great addition. Just like Bybiose. We're going to have a killer team. We really are.
And Chris, phone number and email?
My phone number is 781-397-7049, and my email is cwebb@cityofmalden.org.
Christian.
Okay, I just want to thank you again, Mr. Mayor, and I actually want to put a plug out for Cornucopia Foods. I actually went over there and got some coffee last week, and they're a regular on the show. So I want to put a plug in for them, and I appreciated the hospitality that they showed me while I was there. And I want to thank our special guests. I learned a lot from them tonight. I think I learned a lot, and I'm going to take some of the things that you all talked about back to our team as well, who is, we're all trying to do this together. I mean, this is a coordinated effort, although sometimes we're all jumping all over each other, but we all have the same goal in mind. And, our goal is to get as many people vaccinated. We may not know everybody, but everybody in this community matters. And we need to make sure that we protect them as much as possible. And the last thing we don't want you to come visit us. And I'm over at the hospital, Everett Hospital. You can reach us at 617-665-1000.
Great. All right, Reverend, take it away.
Thank you very much for inviting us to be part of this conversation. And thank you also, Chris, for Jamila. I've known Jamila for 27 years. And so we've been working together for a very, very long time. And we've done also outreach for the TDM. And actually, we're also working with the TDM, part of extension site for EHCC. In Malden in terms of space. So we would like to continue to mimic what we've had there in Haitian churches, also in Malden. Thank you. And we're looking forward to the town hall on the 16th. We hope that it goes forward. It will be great. And from that point on, continue using the strategies that we use, all hands on deck. And at the end, by December, we want to celebrate something with Malden in the growth of number of people that got vaxxed.
That's great. And your phone number again, Reverend?
Yes, 857-251-9866. info@thehcc.org.
Great. All right, Bybiose?
Thank you, everyone. This was a great conversation. You can reach me on my email, which is blarochelle@thecityofmalden.org. And my phone number is 781-397-7000, extension 2006. I just want to piggyback off what Chris said. We did hire a great, amazing, talented woman, and I think she's going to do some great work in our community. She speaks multiple languages, and she knows the lay of the land. I'm excited to just work with her and really just observe all the great work that she's doing, because I think she's going to be a great addition to this work, 100%.
Awesome. All right. And finally, Jenny.
Just wanted to reiterate how appreciative we've been to work with everybody to try and promote vaccines and also, control the pandemic overall and support community members in Malden. GMAACC, our website can be found at GMAACC.org, Greater Malden Asian American Community Coalition. And I also want to highlight that the helpline that we had set up with Malden Neighbors Helping Neighbors is at 781-428-0789. And this helpline can take calls in 6 different languages, English, Spanish, different dialects of Chinese, Portuguese, Haitian Creole, through the help of EHCC, as well as Arabic. So please give us a call if you have any kind of needs related to either finding a vaccine appointment or getting a ride to an appointment or other kinds of logistical support around getting vaccinated. We are here to help.
All right. Very good. So on behalf of Ron Cochran, our communications director here in the mayor's office, as well as Uma and all our panelists, once again, thank you for tuning in. Thank you for your ongoing support. And if you're not inspired after this call, I'm not sure what will inspire you. Let's support the really excellent work that's occurring by our panelists tonight and keep going to where we all want to go. So we'll see you again soon. For now, good evening, Malden.